After tissue expander breast reconstruction, my primary concern is keeping your skin alive. So the most common complication following tissue expander breast reconstruction is mastectomy skin necrosis. This is when the skin left behind, which is your breast skin, that skin that's left behind after the mastectomies can die. And the reason it dies is because the blood flow to that skin is disrupted from the mastectomy. Most of the blood vessels that keep that skin alive travel through your breast tissue, and those vessels are cut when the breast tissue is removed. So the blood flow to the overlying skin or the mastectomy skin is severely disrupted and reduced following a mastectomy. So our initial goal is to keep all that skin alive. I will start by putting this ointment all over it that helps keep it alive. The next thing I need you to do is not put any pressure on it. Don't let any of the nurses or anybody put you into a bra right away. Just no pressure on your skin. Just leave it uncompressed. So no bra. You can obviously wear a shirt and a gown, but don't wear a bra or anything tight that would crush that skin right after the mastectomies. The other thing is, of course, to stay well hydrated and avoid any and all nicotine containing substances. Following that, you can shower after 48 hours. You can let your drains just dangle in the shower. You can exercise 1 week after your last drain comes out. In my experience, the drains that stay in the longest in all of plastic surgery are drains around a tissue expander following a mastectomy. The mastectomies tend to create a ton of fluid, and so we need the drains to drain that fluid. And then you have a tissue expander in there as well, which tends to contribute to fluid production. So the drains the drains that are in place following a mastectomy with tissue expander placement may be in for 2 to 3 weeks. They may stay in for quite a while, so be prepared for that. I found that starting with 2 drains on each breast, which seems like a lot, actually helps all the drains come out faster. So you'll start off with 2 drains on each side, and then we'll take one of those drains out probably within a week, and then the second one hopefully within another week, but sometimes it takes a little bit longer. Once I tell you it's okay, you can start wearing a bra for some gentle compression, which will help those drains come out faster and expedite the internal healing. But we can't do that too soon because we would risk hurting the overlying fragile mastectomy skin on top. So back to the basically recovery period. Shower after 48 hours, exercise 1 week after your drains come out in a gentle compression bra, swimming going underwater 3 weeks after surgery, assuming everything is healed up. But we may need to wait longer than that because it is possible that the drains will have just come out around 3 weeks. Then I'll be seeing you in clinic about once a week, and we will start adding fluid to the tissue expander. We'll use that little port and we will be pumping it up almost every time that I see you, and we'll keep adding fluid to the expander initially to fill up that space. We need to at least meet the skin to fill up that empty skin envelope. After that, we can continue adding more fluid until we reach your reconstructive goal. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.